Hello, everyone. This is Danny Mohsen, and here's a new podcast in the field of healthcare and medicine. As usual, I try my best to bring you the greatest physicians and to discuss the best subjects possible. Today in the studio, I have with me a doctor that proved herself in the domain of family medicine and functional medicine as well. I have Dr. Basma AlRowaily with me today. Welcome, Dr. Basma.
Thank you for hosting me.
You're welcome anytime. Today, I'll let Dr. Basma introduce herself and her specialty to you because it's a very special doctor that has different specialties. Please, Dr. Basma.
So I do have a fellowship in Canadian family medicine, and I do have another fellowship from the American Anti-Aging and Regenerative Medicine College, and I do hold certification in aesthetic medicine from Canada.
That's excellent. You'll be able to cover all the questions we're going to ask you.
All areas of anti-aging, I'm the person for it.
Welcome again. Regenerative means functional medicine, right?
It includes functional medicine.
Functional medicine. I wanted to ask you first about functional medicine. Could you tell me what functional medicine is?
It's a comprehensive type of approach where we take the patient from different aspects. We treat mainly patients with chronic symptoms and chronic diseases that have been suffering from a lot of symptoms. So we cover all aspects from their personal history, their past medical history, their environment, their lifestyle. We go into slightly a wider range of possible causes. So we go to the root cause of their suffering or their illness. We always tend to give them a bit more time. We tend to incorporate more than mainstream medicine solutions for them. So they end up being looked after in a more comprehensive way, and we have a better outcome.
Excellent. If I ask you, who should consult a functional medicine doctor?
Anyone can
Whom
consult.
do you invite?
Anyone. I'm originally a family physician with 24 years of experience. So I incorporate functional medicine with every single patient that comes to me. But the more patients that would benefit from these services are the patients with chronic disease, with fibromyalgia, with chronic fatigue syndrome, with some autoimmune disorders, with hormone depletions, with unexplained symptoms that have been going on for a long period of time.
After the storms that we have witnessed lately, apparently there's a crucial subject that we need to discuss. Stay tuned, and Dr. Basma will tell us more about it. Dr. Basma, you were telling me that mold can come after storms like that. What exactly? What is mold exactly?
Mold is a type of infection. It's a type of spore-forming fungal infection that's usually apparent in a building that has a water leakage. It can be inside the walls. It can be in the showers. It can be in a storage where you have humidity. Any humid, cold environment will be a very good environment for mold growth. It can be in food. We always see a moldy bread or a moldy cheese. It can be in dairy products. So it's everywhere. It's part of our environment. But when the existence of the mold is very obvious, it tends to expose us to health risks because we inhale
This is
it.
where I want to ask you. Do you consider it to be a serious health hazard, and why?
For sure. Now, for someone, there are so many types, more than 400 types of molds or mycotoxin, but only around 12 types or strains that can affect our health. And the worst types are the ones that we can inhale, the ones that you can see actually in a form of a growth on the wall and a growth on your shower curtain. You can see it on a piece of bread, for example. You can
Is
open
it
a
that
bag.
black patch that we see?
Yes, the greenish black dots that you see on parts of the wall, or where sometimes without a color.
On any surface.
It could be yellow. It could be yellow, and you see that it bubbles behind the paint, for example. When you have leakage that has been going on for a while and it hasn't been addressed, then definitely there's mold behind it. It could be white.
So it's not always black, because people relate black color to mold usually.
No, it could be white as well.
Okay.
It could be in AC ducts where hardly you will ever discover it unless you bring a professional cleaning service that will address the mold there. And people usually would come with respiratory symptoms because it will precipitate some sort of an allergic reaction. And people will start having sinus issues, allergic rhinitis, headaches, fatigue.
Okay, when someone experiences these symptoms, he should go to the doctor and investigate about having mold at home or something.
It's when chronic. These symptoms have been chronic, and they've been from one physician to the other. They've treated themselves with so many different types of medication, and yet their symptoms are lingering. People with chronic symptoms like a chronic headache that appeared suddenly, someone who doesn't have migraines, for example, and all of a sudden for a few years they're suffering from headaches or joint aches, fibromyalgia, chronic fatigue, people who have rashes, unexplained rashes that have appeared on their skin all of a sudden, people who have problems with their menstruation, with their fertility. A lot of the symptoms that we worry about is the neuropathic symptoms like numbness, tingling, cognitive decline, dementia, forgetfulness, loss of concentrations. So because when you inhale something, it goes directly to your brain. So the neurological part or aspect is the most significant part, and this is where we need to find answers.
But allow me to ask you, how does it enter the body?
Through inhalation first, this is the most common, and then through contact, direct skin contact through the skin. If you touch it, and we know that the skin is the largest organ in the body, so you're going to absorb it. And of course, if you ingest it. Now, the least effective one is the ingestion because it takes a lot of exposure through the food, like you would have to eat few bags of a moldy bread or a full sack of moldy oats or peanuts. Nuts, of course, are a very good environment for mold, but you need to consume a lot before you start having symptoms.
How can mold be diagnosed? Like mold infection, how can it be diagnosed?
Well, since I do both mainstream medicine and functional medicine, in mainstream medicine, it has to be an antibody test, the ELISA antibody blood test, that will check for around 12 types of mold. In the functional medicine, they do a urine test where it checks for more variety of the toxins that are produced by the mold. And the mainstream medicine, as like with any infection, whenever you're exposed to an infection, the body will trigger an inflammatory response. It will produce antibodies against that strain of mold, and this is how we detect it.
So the main body systems affected by mold are?
The neurological, it affects every single organ in the body, but mainly the neurological system, the brain, the nerves. It affects the lungs, the sinuses, the skin, the reproductive system, the liver and the kidneys, because these are the detoxification organs of the body. So it will go there. The gut is also going to be affected because once they're in the system, everything has to go through the gut. The gut is our organ also to detoxify through the bowel movements. So every single organ system.
Everything. The test that can be done through blood or urine, does it have a name?
There's mycotox for the urine, and the other one is an ELISA antibody, IgG and IgE. IgE is for the reaction of the mast cell, which is the allergic reaction, and we look at the IgE.
Okay, just to clarify again, what systematic complications can result from the mold infections?
Usually patient would present with chronic fatigue, they will have brain fog, they will have memory impairment, they will have poor concentration, they will have unwitnessed joint aches and pains, they will have unexplained rashes, they can have itchiness, but of course the presenting symptom usually it's going to be headaches because of the sinus involvement.
I see. So headache is the main one.
It's a combination. It's a combination of symptoms, and that's why it's very difficult to think mold. Not a lot of physicians would go that route because it's not something that we encounter a lot. Just because we don't look for it, it doesn't mean that
I see.
people don't have it.
Are there any steps that can help us prevent the mold from hitting the body?
For sure. For now, for example, now that most of us had leaks in our homes, it's very important to ventilate. Dark and cold environment is a very good environment for growth of mold. So if we ventilate the area, the sun is a beautiful remedy and treatment for any mold. So if you can have sun exposure, for example, if you've had mold on water on your carpet, just put it out in the sun. Any furniture that has been exposed to water, put it outside and let it ventilate and let some sun rays get on it. The other thing is that get some professional people to look for mold in your house from time to time, because with ACs and humidity,
Specialized companies.
for sure.
Okay.
They usually have special tests to detect the mold, and then they would treat it as well. So they usually treat it with oxygen, with something called ozone, and then they will expose the whole area to near infrared light that also helps clear the mold. This is for professional. But for like our day-to-day, if you have an area that has mold, you have to put a mask first of all before exposing yourself to clean it and deal with it. If you see those spores,
Dots.
the dark patches on your wall, on your shower, so because you don't want to inhale it, so make sure first you wash it out with water, and then you put some vinegar, white vinegar. White vinegar is one of the best detergents that we have in our home. Very cheap but very effective. You can also use sodium bicarb, which is we use it as a baking soda. That
true.
also is very helpful. Avoid using a bleach on it because that will make you inhale more of the spores. And then ventilate the place and then get
Leave it
some
dry.
professional
Okay.
people to, if you want to paint the walls or something, make sure you treat it before. So this is for the like the walls and the showers and the ducts, the AC ducts. Now with food, of course, sometimes you can see it. We tend to, sometimes if we see a piece of cheese or a part of the cheese that has
As
the
a blue
growth,
patch, yeah.
you cut it and you consume the rest. Don't do that because for sure it's already contaminated in all the container.
Oh,
So you
because
have
people
get
tend
rid
to
of
do
it.
that a lot, you know?
Yeah, if you see a piece of bread that has the mold on it, get rid of
Means
the
mold
whole
is
bag.
everywhere.
If you have a potato that has the greenish buds on it, just get rid of the whole potato. Don't cut it and use the rest
so
of it.
it's all
Exactly, a bag of nuts that has some growth, get rid of the whole bag. So
regarding the nuts, is it possible that the nuts do not have any
yes,
patches
there
or
are,
something, but they have
yes,
mold at
of
the same
course.
time?
Peanut butter, for example. We
Okay.
know that peanuts are one of the most moldy nuts that can be, consumed. Whenever they're put in the big sacks and being shipped from one place to another, definitely there will be some mold in them. So avoid peanuts, for example. It's not the healthiest. It's one of the most inflammatory nuts. So, so if you make that into peanut butter, for sure you are consuming some of the mold in it.
I see.
Yeah.
Which kind of nuts is the one that has less possibility to have mold?
Probably walnuts would be among the best, pistachios, but you will always know from the taste, right? Whenever
okay.
you open a bag of old nuts and you taste, it will have this awkward taste to it. It doesn't, it's not crunchy. It has a bitter taste, especially at the end. So that means that it has been moldy. So just get rid of it.
But what if someone consumes a small quantity that is moldy? It's not the end of life, right?
No, it will not affect him.
Okay.
Because as I said, we have a stomach acid that's going to take care of it, and it will take consuming a lot of quantities for someone to get sick.
I see.
So it's the one that we breathe that is more hazardous for our health.
The most dangerous, actually. But now that we know how to prevent it, how to treat it,
first of all, you have to find out where it is and get rid of it. As long as you are being exposed to it, treatment is not going to help. So you have to detect it, then remove it, treat the environment that you're in,
Okay.
and then start the treatment. Now, mainstream, we usually treat with antifungals like itraconazole or Sporanox.
Okay.
Treatment, I should mention, is long. Mold and fungus are very resistant.
When you
and
say long,
treatment,
you mean how long?
3 to 6 months.
Oh, wow,
Yeah.
that much?
Yes, it needs that much to clear from the body.
Okay.
In mainstream medicine, this is what we use, and we use usually supportive treatment for that as well. For the brain, particularly someone who comes in with cognitive impairment, we use something called phosphatidylserine, phosphatidylcholine. These are amino acids that will help the myelin sheath. It will help with the neurotransmitter synthesis. It will prevent the memory lapses or impairment. It will help with focus and concentration. So these are not new. They're over the counter. I've used them for my patients who just come to me and they say, we want something to make us sharp or to make us less forgetful or to help us concentrate. We usually give them something called brain support, and it will have phosphatidylserine, phosphatidylcholine, huperzine, ginkgo biloba. So all of the nutrients which are supportive for the brain, including a B complex that has all types of Bs, the B1 through the B12. Because again, we know that the vitamin Bs are essential for the nerves and for the brain and for cognitive improvement. We give omega-3 as well because it's an anti-inflammatory and it's an antioxidant. We give magnesium because magnesium is one of the most important mineral that's required as a cofactor in our function, in our cell function. We also support with the vitamin D because vitamin D is a hormone. And we know that vitamin D deficiency is actually associated with dementia. It's associated with vascular impairment and atherosclerosis. It's associated with diabetes. So when you optimize all of these nutrients, you help the body regenerate in a quicker form. We give a bit of probiotic because, again, we said you're going to clear it sometimes through the gut, and you need a healthy microbiome because the healthy microbiome is going to improve the immune system in the pyrus patches of the stomach.
I see. So it's not only one drug that's going to heal the mold. It's going to take some time, and it's a combination of different kind of vitamins.
The headline is the antifungal,
okay.
And then the supportive treatment will be necessary as well.
Excellent. While talking about treatment, you mentioned the mainstream medicine. Mm-hmm. How would you treat it in a functional way?
Okay.
Or functional medicine, using functional medicine?
So with functional medicine, it's always longer. And we treat with natural supplements and binders. So again, we start with removing the mold from the environment and detecting it first, removing it, and then we start. So we have to support the liver in detoxification. So we give N-acetylcysteine, we give alpha-lipoic acid, we give a lot of vitamin C. We make sure that the person is taking chlorella because chlorella works as a binder. We give something called astaxanthin. Again, it's from algae and it binds to the mold, and depending on what type of mold we have, we can choose the binder. We tend to make sure that the patient is using some aged garlic because we know that garlic is one of the most potent antifungal treatment. Wow. Oregano oil is also another treatment that you can use to kill any mold or any candida in the body. And we tend to use a binder called cholestyramine. We choose it in very, very tiny doses, and we increase with time because it has a bit of side effect to that. We always check for candida whenever we're looking for mold as well, and heavy metal. So we cover all those aspects. We give melatonin as well because melatonin, we're not using it only for sleep, but we're using it because it has neuroprotective effect, especially for people who have a lot of neurological disorders or symptoms.
So is it enough to use these natural components, if I can say,
We
without
have,
medicine?
we always give, I
Any
always
chemical?
I always give my patients the option, because we do have, the patient has to be part of the management,
Of
right?
course.
And we give them the choice. So I have so many patients who come to me and they say, we don't want any chemicals, we want natural treatment. So we can do that. And after 3 to 6 months, we can check them again. And if they're still, the numbers are the same, like they haven't reduced the load of the mold, we can always recommend that we can go with an
Drugs.
antifungal, a chemical.
Excellent. But now that we've known how to prevent it and how to heal it, I need, by the end of this podcast, an advice from you or a recommendation for people in the event of the rain, the storms, and everything else. What do you recommend people to do?
First, water, I mean, now that they anticipate that rain is going to come, make sure that you waterproof your homes. If you have any leaky windows, make sure you get someone professional to seal it for you. So this is the first thing. They are putting sandbags in front of the areas where water can seep through. If you have any carpets that might collect some water, you can like remove them and put them in a higher place. You can get a dehumidifier for your home and place it. Get the professional companies and make sure that you do a bit of research about the companies that they do treat with mold, because it's very rare that you find a professional that knows what they're doing and they do have the machine and the equipment.
I see.
So these are the things that I would say, and be prepared with, you know, your white vinegar, your tea tree oil, your sodium bicarb, or the baking soda at home, and don't allow the water to sit for a long time. If you dry it fast enough and aerate the place and make sure you have good ventilation and sunshine, hopefully we wouldn't get a lot of mold exposure. In your bathrooms, always make sure that you place charcoal, activated charcoal. We always know, we know that activated charcoal will absorb any candida, any fungus, any humidity from your room. So just place in the dark areas some charcoal. And sometimes we open just a baking soda box and we place it in the fridge. Make sure also the refrigerator, speaking about that, it's a very good area for mold growth. So from time to time, make sure you do a proper clean, and there is the back of the fridge usually is the area where it holds the mold. So you can clean that again with
The
white
back
vinegar.
of the fridge, you mean the outside?
The back of the fridge, there's like a cupboard or where the extra water collects.
Okay.
So this what needs to be cleaned with the brush, and you put the
and vinegar if possible.
the vinegar and
White vinegar, you said.
Yes, and the sodium bicarb, and the same for your washing machine as well, because the mold can be on your clothes when you every time.
That's why they recommend us from time to time to add vinegar to the
Actually,
washing
keep
machine.
the door open. Yes, keep the door open after you've removed your clothes from it, because there's a lot of heat and there's a lot of humidity. So if you close your washing machine door after drying or even after a hot wash, then the humidity is going to collect all the rubber sealing inside. You will open it and see the mold inside.
Yeah, indeed.
So that needs to be addressed.
But
that
is it enough to keep it open? You know, usually
no,
these
you should clean
washing,
it as well.
washing machines are in places that where the sun does not reach.
From time to time, we actually do a cycle with vinegar and sodium bicarb as well.
I see. Excellent. Thank you very much, Dr.
You're
Basma,
welcome.
for sparing the time to explain to us about mold and how dangerous. Honestly, we did not know it was that dangerous for the health of the people. Thanks a lot again.
You're welcome.
It was a nice time spent with you. Very informative.
Thank you, Danny, for
Ladies
hosting
and
me.
gentlemen, stay tuned. I hope this podcast was quite informative to you. Stay tuned for more subjects. See you.